The new National Care Service, I guess you'll have read in the billing about this event, and I guess if you follow the news, it's been billed as one of the biggest public service reforms that's happening. I was a full-time carer myself for 12 months, so it's an issue that's particularly dear to my heart, and I really think if we look at what's happening in terms of population statistics and the way we all live now, it's just going to become a bigger and bigger issue over the next few years. So really pleased actually to see Scottish Government kind of taking a real helm at looking at this and driving forward these reforms. And I'm really delighted today to welcome Ingrid Roberts from the National Care Service team at Scottish Government. Good morning, Ingrid. Ingrid's going to start our session off today, just talking about the work that's happening. And then we're also going to hear from Hannah Tweed, who is Senior Policy Officer at the Health and Social Care Alliance Scotland. So thank you both for joining us. You'll be pleased to hear I'm going to stay quiet now for a few minutes, and I'm going to hand over to Ingrid. As ever, if you've got any questions as we go through, use the chat, use the Q&A, and we will come back in at the end and have that chance to ask any questions. So thank you very much for joining us, and thank you, and over to you, Ingrid.
Thank you, Naomi, and good morning, everybody. Thank you so much for inviting me to come and speak to you today. A bit of an overview. We had in government the Independent Review in Adult Social Care, and they reported in February 2021. And that led to the government committing to establishing a national care service by the end of this parliamentary term, and to consult on that with a view to bringing forward legislation within its first parliamentary year. And so the consultation launched on the 9th of August, I beg your pardon, and closed on the 2nd of November. And where we are now is considering all of the responses to consultation, which were published on the 1st of February, and the independent analysis and report of the responses to consultation, which published on the 10th of February. For a little recap, the Feely Review, the independent review, looked simply at adult social care, but the government and ministers went significantly above those recommendations because they view this as a collaborative cross-government opportunity to deliver transformation and to ensure that changes are real and that they make tangible improvements to the outcomes of people who work in or support those to access social care. So the proposals in the consultation were that a national care service would oversee the delivery of care, that it would improve standards, it would ensure enhanced pay and conditions for workers, and provide better support for unpaid carers. And there are a number of things that the proposals in the consultation set out to do. I won't go through them all, but embedding human rights and the living experience should be at the heart of a national care service. Everybody should be included in a national care service. There was an agreement that to achieve parity within the NHS, children and young people should be included. That it should include all community health and social care services within its scope and essentially form a community health and social care service. That they should include the social work profession, either in whole or in part, as part of the national care service. That it should embed fair work and workforce development in legislation, that we should have referencing and support for unpaid carers, that we should include addictions and support services, and that we should include or align criminal justice social work services. So that consultation received just under 1,300 responses, which is fantastic. Throughout the consultation period, around 100 engagement events and sessions were held, and we had the opportunity to hear from stakeholders, partners, and people who use social care and support services. Now, the analysis report, I'll give a quick summary of the responses. A significant proportion of the responses came from individuals with lived experience, which is just fantastic, or they came from bodies that represented those with lived and living experience of social care. And the social care workforce were also well represented in the responses, along with providers. Overall, there was strong support across the responses for the main proposals within the paper. However, some respondents did raise a number of concerns about the proposals and highlighted some issues that will need some further thought and investigation as we start to develop a national care service. Now, I think the key results that people will be most interested in from the analysis, and this is publicly available, but I'm just going to highlight a few. 72% of respondents to the consultation agreed that Scottish ministers should be accountable for the delivery of social care. And the majority of responses, so about 76%, agreed that the National Care Service should include both adults and children's social work and social care services. Quite a large proportion, about 77%, agreed that the responsibilities of the alcohol and drug partnerships should be integrated within the community health and social care boards. A majority of respondents, about 72%, agreed that given the responsibility for social care services in prisons to a national care service would improve outcomes for people in custody and those being released back into the community. About 3/4 agreed that primary mental health services, children and adolescent mental health services, community mental health teams, crisis services, mental health officers and mental health link workers should all be delivered within a national care service. National Care Service and Community Health and Social Care Boards agreed that they should commission, procure and manage community healthcare services. Now, those are the functions that are currently delegated to integration joint boards. That was about 70% of people. And there was general agreement about the potential benefits of a national social work agency. That was about 66%. Around 3/4 of the respondents agreed that community health and social care boards should be the sole model for local delivery of community health and social care in Scotland. There was also broad support for the proposals in the consultation paper around ensuring care and support is human rights based and person-centred, that there should be a right to breaks from caring, the ethical commissioning approach and for procurement of complex and specialised social care be done at a national level by the National Care Service. Support for proposals to improve regulation and for a regulator to have a market oversight function. And proposals to improve fair work in the care sector, to create the conditions for better training, development and career structures for care workers and social workers, and for the National Care Service to undertake workforce planning. So, as I said, the report is publicly available, and if anybody doesn't have it, I'm very happy to forward the links to Naomi, which can be shared with everybody, and the links to all of the individual consultation responses where permission was given for us to publish. I can send those on if people want to go in and have a look for specific things. That's just a bit of an overview. So next steps, where are we now? Ministers are currently considering the analysis report that was published on the 10th of February, and that will allow them to come to a view on what the National Care Service should be. I would expect an announcement on that scope and the remit of the National Care Service sometime fairly soon, so please watch this space. One of the things that I think is going to be interesting for this webinar is how social enterprises in the third sector can play a role in working with Scottish Government and colleagues to develop the National Care Service once ministers have taken a view. The intention of the Government is that ethical commissioning and procurement becomes a cornerstone that the National Care Service will use to oversee continuity of approach at a local level. I think one of the key things that the Minister and the Cabinet Secretary were both being very clear about is ending the postcode lottery. So it shouldn't matter where you live in Scotland, you should be able to access the services that you need to support you at the right time. And having a national body overseeing the commissioning of all services is something that can help support that. The consultation addressed the membership of the planned community health and social care boards, and what we had proposed was that these boards should have members that represent the local population, including people with lived and living experience of accessing health and social care, and carers, professional group representatives, as well as locally elected members. And the consultation then proposed whether there should be anybody else represented on these boards. Now, 319 people responded to this question and proposed the following suggestions. So people with lived experience, frontline workers, funders, general practitioners, community nurses, teachers, police force, and the third sector. There was also a number of comments around the balance of representation, ensuring that the inclusion of people with lived experience wasn't simply a token gesture, and that we had to create a balance between including disparate voices and keeping decision-making focused on a pragmatic number of people so that the board size was reasonable and manageable. So when I asked, when I mentioned earlier about NCS and the question that this was number 27, I think, if you wanted to go and have a look, 70% of the people who responded agreed. Now, before that, because the commitment is to have a national care service established by the end of this Parliament, which in reality is 2026, the key thing is how you and any organisations that you represent be involved now. Now, we have a number of engagement plans which are being prepared as we speak, and I'm pretty sure that they will be made publicly available on our website. We have a National Care Service page which is being updated daily. But a couple of the things I can talk about right now, a key stakeholder reference group was formed, and I think Duncan actually is a member. Unfortunately, I have never made a meeting. Their next meeting is tomorrow, and I suspect that they will probably go through the analysis of consultation responses like I have done with you today. So sorry, Duncan, you're probably going to hear this twice. I will happily make inquiries if there is a view that some of the stakeholders who should be as part of that reference group aren't represented at the moment. And again, I can share a list of membership or membership organisations with Naomi to disseminate round if that would be helpful. I think the other thing worth mentioning is Ministers committed also to having a social covenant steering group. They committed to setting a covenant steering group up within the first 100 days of Parliament, and that's what they did. The membership of that group at present includes unpaid carers, disability rights activists, a care home resident, a campaigner for the needs of relatives of those in care homes. We have a representative for hearing and visual impairment, a social worker, and others with significant experience of the way in which services are currently delivered. So this diverse group of people sit about every 6 weeks. It is chaired by the Minister for Mental Wellbeing and Social Care, Kevin Stewart. Everybody comes from across Scotland. There is a spread of ages and social, cultural and ethnic backgrounds on the group. It's quite a flexible group as the programme to establish the National Care Service develops, working to drive better outcome for people. The kind of key principles of the social covenant is this joint commitment by people, organisations and us in government to set aside self-interest and to each work together for the common good. In this instance, it is ultimately to deliver better outcomes for people in social care, whether that is receiving it, supporting people to receive it or working there. It's really important if we want to achieve our aspiration for everyone in Scotland to get the social care that they need. In the 2014 report, the World Economic Forum described a social covenant as a way to establish a common set of values and beliefs, the dignity of a human person, whatever their race, gender, background or belief, and the importance of this common good that transcends individual interests. I think the role of this group ultimately is oversight. It's not a concern just for ourselves, but it's for future generations as well. So we have the opportunity to get this right. I think I'm going to stop there, and I think questions are at the end.
Thank you very much, Ingrid. It's encouraging to hear. Obviously there's a lot going on in terms of this work, and a lot to try and cover in a session. And I can see Hannah's been sharing, I think, some of the links to documents and things that you were referencing as you went through, which is brilliant. So thank you, Hannah, and hopefully that's helpful. And I'm sure there'll be lots of questions as we go through, and I can see people already asking that it'd be useful to have a sense of those stakeholder groups and those names. So what I will say is, I know Hannah's got slides coming up next, so we'll share them afterwards, and if I get some of those links off Ingrid, we'll just wait till they're through and we can share them at the same time. So thank you very much, Ingrid. Before we do come to questions, I'm delighted to welcome Hannah. Hannah's joining us, as I said, from Health and Social Care Alliance Scotland, who are, I guess, along with ourselves as a social enterprise organisation, will have responded to the strategy. And I think we worked with the Alliance and specialists in our sector to get that right. So I'm going to hand over to Hannah now, who's just going to take us through her presentation.
Grand, thank you very much. And please excuse me while, as always, I present you loads first instead of something more useful to you. That was really, I'm pleased I'm going after Ingrid, because the summary there, I think, feeds very usefully into what I'm hoping to say, and also was done much better than I could have done, having only had a very quick chance to skim part of it while juggling a sick toddler. So please don't direct specific questions about the analysis consultation of the consultation response to me, because I won't be able to answer them yet, and I'm just putting that out there because life happens. However, I was the Alliance lead on the fairly detailed response we put into the National Care Service consultation, drawing on extensive input from our members, and really prioritising lived experience and people's feedback into engagement events we've done to inform the independent review of adult social care, and into a project called My Sport, My Choice, People's Experiences of Self-Directed Sport in Scotland, which was just pre-pandemic, but really did provide insight into what's happening on the ground and good practice that needs to be preserved, and areas that hopefully, and I think there's a lot of common drive for this, the NCS can respond to and counter existing problems within the system, hopefully. So, one of the key elements of our asks and our aims to work towards within the National Care Service is, unsurprisingly, given our tagline, lived experience. We're very firm in feeling that lived experience should be at the heart of practice and policy. And we're also really reassured and welcome the commitments from the Scottish Government around this. I think the statement in the NCS consultation document used the phrase placing human rights at the centre of decision making and shifting that emphasis really throughout. When I was doing a quick Google earlier, I think there were 43 references throughout the analysis to human rights. That also links inherently to good co-production, good co-design, and transparency throughout the process. But I guess my question off the back of that is, how do you meaningfully make sure that people with lived experience continue to be enrolled in the NCS? I think the comments about the engagement plans sound great. I've got a colleague who's part of the Social Covenant group, so I've been getting regular reports on the progress and the detail that they're working on. And like SES, we're also part of the key stakeholder group. And these are really positive parts of the development of embedding lived experience throughout the process, and very welcome. I guess I also have questions about what can be placed and embedded within systems designed from the outset to see that follows through at every level. So, for example, what funding and support is available for embedding inclusive and accessible communication to work with people with lived experience throughout the ongoing development of how things are, an assessment of how progress is being made, about how, whether things are working, where they're working, where they're not working, and how responses are made. Is that available in community languages, BSL, Braille, Moon, Easy Read, clear and large print? Do we have simultaneous publication? So what sort of timescales are involved in that? And I think that's a real challenge. It's not an easy thing to get right. So there's a real need to have sort of communal working towards this. Also, probably equally unsurprising, we think that there's a real need to see direct work with third and independent health and social care organisations as equal and valued partners throughout this. And as part of that, we need to see adequate resourcing, and resourcing that, first and foremost, also needs to be sustainable. So at the moment, we're getting reports of the example of the analysis stating that community links practitioners are really having positive impacts on people's experience of social care and interconnected policy areas. Great. Doesn't surprise me. The Deep End GP report from last year is very much echoing those findings. It's what I've heard from colleagues across the sector. And yet a lot of individuals working in those roles are on one-year contracts, and that means you see high rates of staff attrition. So what can be done to really embed those commitments to ethical commissioning and procurement processes that sees those sustainable patterns in place and reform thereof? I think that's also something we saw echoed in the independent review of adult social care engagement events that we ran, asking, where's the connectivity between third sector provision of health and social care and NHS side and local authority health and social care partnership side? Getting those connections and that sharing of appropriate sharing of data. I'm not asking for inappropriate sharing of data, but that connectivity, that mutual working towards a common goal, I think is really important to embed early, or we're going to see repetition of the same problems that currently happen in the system, despite the best intentions of people involved. That also plays out through the 2020 framework for integrated health and social care services. I know that there was a quote saying the third sector would need to be supported by the redevelopment of the commissioning and funding procedures, which initially created this competitive climate. So this has very much been on the radar for a while. I won't be telling you anything new, but I do think it's important to stress at this stage of the conversation as a key priority. And to ask, how will that change happen in practice? How will you be able to sustain existing services while moving to this new model? Just sort of throwing some awkward questions out there while I'm talking. As I mentioned, alongside the lived experience, human rights are at the forefront here. We want to see an explicit integration of equality and human rights across all parts of the social care system, including the legislative structure, real explicit commitments in Scots law to human rights. And I also include that in the fiscal material, the inspection systems, regulation, commissioning frameworks, employment and workforce development, service design and delivery, monitoring and evaluation, right through the entire life course of this material. That also needs to come alongside empowerment activity, specifically around rights holders, so people who access social care, unpaid carers, their families, social workers, social care workers, to know and understand how to claim their rights and to support duty bearers to do so too. So that would be public bodies, service providers, improvements and scrutiny agencies, so that can really have a meaningful engagement with something like panel principles. So participation, accountability, non-discrimination, empowerment, legality, things that are embedded throughout the intentions of this consultation document, and we want to see put into effective practice across Scotland to basically improve people's experiences of social care, which I think is the bottom line of all of this conversation. And pet rant, I promise not to go on too long about this subject, but this is mired in many ways in effective data gathering and analysis. If we don't have disaggregated data gathering and intersection analysis, we can't ensure equitable access to social care because we won't know where it's working, where it's not working, and for which groups of people. It's absolutely essential that is embedded now, because without it, you can't effectively follow the human rights principles of equality, non-discrimination, participation, and inclusion. That means not just collection of data without exhausting on-the-ground social workers. I'm not looking to add to an already intimidating caseload, or care providers who are already doing substantial paperwork, but it's about working out what is the minimum number of questions you can be asking to get the maximum output of information about service delivery, and making sure that happens the same way across Scotland rather than 32 different ways across 32 different local authorities. And really drilling down to things like socioeconomic information, ethnicity, age, gender, etc., protected characteristics. That also needs to be published at regular intervals. Again, if it's not published, there isn't that public accountability that is linked into those human rights priorities. And it also makes it difficult for people on the ground to go, actually, this is where we should be focusing our action, because now we've got information about what people need. So I think that's absolutely key. It's also connected to some of the questions within the consultation document about people's control of data and how data is shared. And that's also something that we heard from our members and very strongly feel should follow a digital choice method, that there should be that ability to share information with the third sector where appropriate, but that individuals should have control of and access to any data within a new system. It's not easy, but it is the outcomes of that have real potential positives to deal with some of the existing issues within the system. So again, awkward question, what are the data priorities for the National Care Service? I'm whistling through a lot of stuff here, and I'm conscious I could go on at some length about all of these topics, which I think probably isn't the key aim and intention of this presentation. So I'll stop there, but I'm happy to go back to any of those topics, and would welcome input from everyone on that. Thank you.
Thank you, Hannah. Gosh, there's been so much in both of today's presentations, and it's as someone who's not day to day involved in this kind of work, there's quite a lot to take in and absorb. So I'm very grateful that people are putting questions in. So we know we've got social enterprises on the call that very much work in this sector. So I'm going to perhaps come in with a few of those early questions first. And I guess it's one I'm thinking ahead really to that 2026. And I'm also thinking, what is it that we as social enterprises can do now to help, or whether that's as a support organisation or as social enterprises themselves, to prepare for a new service? And that relates really to David's question about kind of benchmarks and standards, because I think we've got time to prepare for that 2026 if people need it. So do you think there's going to be that sense of standards and quality benchmarks that will come in, Ingrid? And how can organisations prepare for that now?
Yeah, really good question. In fact, there's been some fantastic questions. I might pick up with you actually afterwards to get a copy of all the questions so that I can come back and answer them all. I'm conscious of time. I think there's a couple of things. First and foremost, ministers haven't yet made a decision. And so until we know the scope and the remit of a national care service, we can't begin the detailed work to co-design where appropriate with all of the different groups that we are working with through the people-led policy panel, social covenant steering groups, key stakeholder reference group, etc. I think there's a couple of things that are probably go without saying. The National Care Service will have a Charter of Rights, and that will sit on the face of legislation. The National Care Service will also have a set of principles. So if anybody is familiar with the Social Security Scotland Act, they have a set of principles by which Social Security Scotland will abide. And I would very much expect the National Care Service to have similar principles that are appropriate for care. Now, these are the things that ultimately ministers will be held accountable for. These are the things on the face of legislation that people and services can point to and say, this Charter of Rights sets out that XYZ, or the National Care Service principles are these, and this is what we will be held to account on. How I expect it to work is that the National Care Service will undoubtedly have to report annually, both in Scottish Parliament, but regularly through improvement data. If we are having the largest public sector reform since the creation of the National Care Service, we have to be able to demonstrate that it is benefiting people. So there will be ongoing improvement, and I would absolutely expect scrutiny and reporting on that regularly. I don't know if that answers your question or not.
I think it certainly helps. I think the question on perhaps some of the standards is also something that the social enterprise sector also has to look at as well, in terms of that being perhaps a broader question, as well as looking at the guidelines for particular sectors. So I think there's something in that. I think I was going to ask, if I may, and it relates to this, Ingrid, as a question, and then I'll come into with some questions for Hannah. It's a dreaded P word that always gets asked when we're talking with public sector, which is all about procurement. So we know that one of the big challenges for lots of our social enterprise organisations is that often procurement guidelines, even in terms of they might have fabulous experience in running services, they could put in a great case, but they simply can't get through pre-qualification questionnaires. They don't meet the standards in terms of, I guess, the baselines that are requested in terms of contract sizes. Is there anything that will happen around that procurement agenda that actually makes it easier for smaller local providers to come in and deliver services through this framework?
That's definitely the intention, Naomi. It's definitely, we've got procurement colleagues within Scottish Government working on this at the moment with a range of key partners. So it's not something that I could say in detail, oh, and here's how the National Care Service is going to do it, but they are definitely looking at it. You raise a hugely valid point. I think one of the overarching themes from our conversations across the consultation period was in particular, the third sector never having the ability and the space and capacity to bid, and big organisations always getting in. Whereas when you speak to people, their best experience of social care tended to be in small communities with third sector organisations. So it's something that we're very, very alive to.
Thank you. I mean, it's interesting, I think, as we've seen even agendas around things like the community wealth building agenda grow as well. I'm seeing more local authorities actually now even putting out that they're putting more contracts through even the quick quote system. So we are, I think, starting to see some of that change, but does it always happen at the speed it needs to? I think for the organisations that are there, because capacity is a major issue, and you know, the key strength, I think, of the social enterprises that provide services is actually the beneficiary is their key focus. So when they're tight on capacity, their energy will go towards the service first and foremost. So that's always a big challenge from a capacity perspective, which actually means that sometimes some of your best providers simply can't bid in just because their focus is actually on the right things, which is the service user. So it's a big challenge. Hannah, I can see you kind of nodding. I wondered if you got any thoughts and experience just around this kind of procurement topic that might be worth adding in here.
Yeah, I should also say I'm an enthusiastic head nodder, so please don't be put off by me doing that. Yeah, no, I mean, what you were saying was really striking a chord with me with the CCPS's 2021 publication of the business survey, which I think
and just go CCPS. We do acronym busting through our sessions.
Thank you. Thank you for calling me on that. I'm terrible at doing that. That's the Coalition of Care Providers in Scotland, or it might be for Scotland. Don't quote me on the smaller detail. And they do a business survey of their members every 2 years, I think, assessing the impact of sort of changes to the sector and what that means, essentially. And I remember I'm sure there was something in the most recent publication talking about, because many local authorities and social care partnerships suspended previous procurement models during the first year of the pandemic. It was the first year they'd seen a lack of sort of just previously the sustained pattern had been year on year, fewer and fewer organisations having the capacity to bid, just because of exactly what you're saying, that sheer time commitment, particularly the smaller providers. And yet that's at real odds with, again, recent evidence coming out about best outcomes for people in terms of satisfaction, health, etc., in terms of residential care being in smaller provision. And that's just one example. I mean, there's obviously a much bigger sector, and there was a comment in the chat about organisations not just in statutory services, but work in areas that supplement and help people to remain independent, and it's absolutely relevant there as well. You know, number of our members report same sort of concerns. But I think it's really interesting that we've got that sort of evidence base from the pandemic as a sort of, not by accident, but because of that shift. And I think it's really important to draw on going forward.
Yeah, I mean, I think we would all wish the pandemic hadn't happened, without question, I think, but there's definitely, I think, a real strength that's come out of it in showing actually that communities, I always talk about risk, because I think sometimes we have an unfair risk analysis of community organisations, and should we really judge risk based on turnover size, which I think there's a tendency to do from a procurement perspective, whereas actually I think the fact that communities stepped in quite quickly when perhaps some of the more normal risk and due diligence frameworks, I'm not saying due diligence isn't important, it's critical, particularly with care, but I think there was a change in approach as to what that actually meant. And actually, I think the sector showed that it absolutely met what the due diligence sets out to do. So I think that's quite an interesting perspective. I'm just going to come to a question that Susan's put in terms of, obviously we've talked a little bit in terms of statutory services, and the procurement agenda certainly fits in that. But what's happening in terms of, I guess, the National Care Review, in terms of perhaps some of that work that supplements supplements statutory care, such that it helps people remain independent? And I think particularly there's a social enterprise that comes to my mind, Glen Urquhart. There were houses built in Glen Urquhart where normally all care facilities were miles away in Inverness, so people that had lived in their communities for years suddenly couldn't couldn't live where all their friends live. So, you know, some innovative initiatives that happen there, but aren't potentially kind of statutory in the usual way. Is there a sense that the care reform's looking at some of that broader perspective as well, Ingrid?
Yeah, definitely. I had been reading Susan's comment as you were speaking, and it is an absolutely critical one that was raised an awful lot throughout the consultation period, and with various people that have been in meetings with Mr. Stewart and the Cabinet Secretary for Health, actually. And interestingly, the examples that were given were in relation to the islands. So where, you know, particularly during the pandemic, some sort of services for whatever reason could not be run, that the community had stepped in and supported and kind of formed a social enterprise of sorts out of necessity to support people. And both the Cabinet Secretary and the Minister were very, very interested to hear about how that would work and how that would look going forward. So there are no hard and fast rules, but they are absolutely clear that in some instances, that is the most appropriate thing for an individual. What we envisage for the community health and social care boards coming together with all of the statutory partners and those who are not statutory, because we've already indicated we'd be very keen to have a range of people sitting on these community health and social care boards. They come together to consider planning for services at a local level, even though they've got an oversight at a national level. We recognise that kind of planning for service provision is best done locally. I have to think about how community planning partnerships and that organisation fits in and how that all links in. These are things that are on our minds that we do not have defined answers to yet, but it is absolutely key that we continue to recognise the benefit to individuals, because this whole reform has to make it better for people. And if what currently makes it better for people is a combination of statutory and non-statutory service provision, then we wouldn't want to take all of the good work that's happened in the pandemic and lose it, you know. So we're very, very open, Susan, to all sorts of initiatives. What we had said to individuals when they'd raised it with us was, if you have got an example of good practice, please share it with us at the National Care Service, still called consultation mailbox, even though we're past the consultation, but to please share your examples of good practice, because as we start to consider how things are going to work in reality, when we know what the National Care Service is responsible for, then we absolutely want to draw on the things that are working well. Equally, we want to know what doesn't work well, you know. Now, I appreciate that everybody responding to a consultation, either as an individual might not have the time or the space to do it. As an organisation, sometimes people responding on behalf of the organisation feel a bit conflicted because they might hold a different view. So if there are things that aren't working well that you think we should absolutely not do, it's not too late to tell us as we're working through this. I think the key thing is that when we do come together to consider how it works, it has to be with everybody, because, you know, okay, I am a carer of sorts as Ingrid Roberts, but I'm approaching this work in my role as a civil servant. And so I am not going to be cited on the issues that affect a broad range of people. I can only draw on my own experience. Sorry, I've gone off tangent a bit there, Naomi.
No. It's interesting because I think you get that sense of the kind of the wider approach that's been taken actually by some of the tangents. So I'm not worried about some of those at all. I can see a few more questions are going to have come in. I'm going to just come back to Hannah, if I may, which is a slight change of thing, but it's a question about, I guess, targets and how do we set those realistically, particularly in line with resources. We know I guess we all know when we want to see improvements in the care service, but I think even the fact that we're seeing, I guess, the increased taxes that has been raised by UK government, how does that fit in with Scotland? And we all know that there's a resource need to match some of what the ambition is with the care service. How do you think we can balance the resource need and the target setting?
I think this is it's a good question. I don't have an easy answer to it, in that I think on the one hand, we need to see systematic evaluation and data-informed decision-making. I think that generally is an uncontroversial position. It's also about going, are we relying just on quantitative data, on how many people are within self-directed support, which I'll probably call SDS at some point, apologies in advance for acronyms. Within self-directed support, you'd have options 1 through 4 of different sort of variants of how care might be delivered. It's all well and good collecting data on how many people use 1, 2, 3, or 4. Actually, that doesn't tell you very much about whether that's what they want and whether it meets their outcomes and whether it meets their needs and enables them to live independently and well, which is the sort of core essence of it. So there's a little bit about asking the right questions that I think can only be done via qualitative and quants data and getting that combined versus snapshot versus whole large scale work. And that is not easy, and I'm not criticising Public Health Scotland when I open that can of worms, but I do think it's important that that's embedded. I think that probably needs to be part of an independent audit body's job, because I think if you make it the job of social workers on the ground and care providers, it is too much for an already overstretched sector. Although it obviously involves speaking to those people as well as people accessing services or who wish to access services. And I add that latter because at the moment we basically have no data collection on people who wish to access services but are told they don't meet the normally moderate, not crisis level, separate round available on request, level of assessment eligibility criteria. And that does link into resources, because actually the reason those eligibility criteria are quite exclusionary and don't meet that sort of commitment to early intervention care is not because there isn't a wish to support people, bluntly, it's because there isn't funding or the support or the resources. And that becomes a bit of a self-fulfilling prophecy, because if you can have early intervention, fewer people reach crisis, it's better for everyone and it's cheaper in terms of budgetary, and there's work on this. I think the Fraser Allender article linked there is an interesting one to draw on. I would like to think that accurate, regular data collection in the way that Ingrid was outlining, if that happens, that can be part of a slow process to improving that targeted resource. And I think particularly in terms of intersectional targeting. For example, we found that in my Support My Choice that it's not always about money as well, it's about investment in resources in terms of information. So we found that in project I was involved in that women accessing social care from the lower socioeconomic backgrounds, SIMD, I can't even remember what that acronym stands for, were fairly, 10-20% less likely to be given information about their budget, to be given full choice, to feel that all the questions were answered, to have been given information about all options available to them than women in the highest socioeconomic, that kind of thing plays through. And that's a matter of targeting information. Information is relatively cheap as resources go. Certainly compared to the start of a new service. So I think it's also about drawing on that material and working alongside partners who are already doing really good work in terms of that sharing. So things like independent advocacy organisations, local providers, local people on the ground, local organisations on the ground who are doing that community-based research. And that's where that connectivity comes in. That's a really specific example. Sorry if that's a bit too niche.
I think it's really interesting, because for me that point about kind of how do you make people fully aware of what's available is really important. And I draw again just on my own experience as a carer. I was able to argue and fight for quite strong care because actually I'm confident on the internet, I'm fairly articulate, even if I do say so myself. So but actually that gave an unfair disadvantage actually in terms of care to those who perhaps don't have access. So I think that information point's really critical if we want to really truly operate a fair care system for all of our communities, because at the moment it is what that helps you kind of get the best care that you can.
And I guess my only codicil with that is I don't want to end up with NCS targets that become like some of the NHS targets, some of which are helpful to people and some of which are reporting for the sake of reporting and adding a great deal of stress without much direct correlation to people's experiences. And that's not an easy task, but I think it's also worth considering.
and I think coming back to that, it's that pragmatic point, isn't it, about what is it that we can realistically do such that we're not detracting resources from the wrong thing, but we're able to ensure that we're doing the right data and collecting the right information that actually spends resources in the best way we can. We need to have the knowledge to do that, but if most of our time gets spent on, it's always the criticism, there's more money spent on the managers than the care itself. So we've got to get that balance perhaps right. I wanted to come back, I'm going off on a tangent again because it's such a broad topic, and I wanted to come back at the very start, Ingrid, you talked about obviously embedding Fair Work. Now I think those of us again who've worked across the care sector or are familiar with it, we know recruitment's a real challenge. We also know pay's a massive challenge. And I just wonder, I think again, in terms of that 2026, it sounds a few years off, but it's going to come around quicker than we think. What is it we are looking to do now in terms of, I'm thinking kind of training, careers in care, and is there a link here in terms of work that Skills Development Scotland are doing, and how are we looking at fair pay in terms of contracts that come out as well?
Oh, that's a really good question, and I'm completely not your woman. So we're not in government. We are not waiting for a national care service to be established by 2026 to make improvements. There is improvement work going on across government as we speak. Now, I do have colleagues who are working on Fair Work, the carer strategy. There is a preventative approach programme kicking off. I'm so sorry, these are things that I am not directly involved in, but what I would say is that groundwork of kicking off all of the improvement work will at some point be taken on by a national care service. I am kicking myself for not anticipating you asking that question, Naomi, because I could have got you the answer. I think we have to minimise and try and find it.
I think we have to recognise that this is such a big topic. There are so many strands in terms of this. I mean, that's why it is being billed as one of the biggest reforms of many years, because it is broad ranging. So we know you can't be an expert in everything, Ingrid. So actually, I appreciate people saying when they don't know the answer as well. I said that before we went live. You know, I always say, don't make an answer up. It's better that we tell people to wait and we'll get back to them. So that's all good.
No, I will. I'm going to minimise, take myself off mute, find the answer, and I'll post it in the chat.
Thank you, Ingrid. So, while Ingrid's, go on, Hannah, I was going to say, because I was going to come into you for some input while Ingrid's looking up the answer.
Yeah, I mean, I won't pretend to have the answer from a Scottish Government perspective under the proviso just mentioned of don't fake knowledge you don't have. But I know that one of the things our members have been calling for, and we've in turn been putting into a lot of our policy work lately, is precisely that point about the interconnectivity of a lot of the NCS implications and what preparation is required, and other bits of legislative work going on at the moment. So I've just stuck a link in the chat to the consultation on becoming a Fair Work Nation, which has very strong overlaps with what is needed to see social care in particular, but social work in particular, but a whole range of connected points of engagement in the NC National Care Service done right. And there's gender equality concerns there about the welcome £10 to rise, but what does that mean in terms of actually having promotional opportunities and career development opportunities that are genuinely commensurate with the NHS? Because at the moment, yes, that's the same banding, but that's not the same as having the potential for internal promotion and sustainable contracts. And I think this is an opportunity. I think it's also one that, again, we're back to resources, because if you give people longer term contracts, and by people I mean organisations there as well, they can invest in staff, and that reduces that turnover problem. It's really, really hard to effectively illustrate fair work throughout if you're on 12-month rolling organisational contracts. It's not impossible, but it's much, much harder, and that's where, if commissioning can be prioritised, you can begin to see this change earlier. because things like that chime with a lot of other work going on within Scotland. That's my 2 cents.
Do you know, and I think that sense of the right contracts and the right approach is critical. And again, I'm speaking from a personal experience perspective here, and I was in England at the point when I was a carer, but we fought to have statutory home care still provided rather than outsourced private care, because actually with the staff that came from the statutory sector, they had good pensions, they had in some ways a better contract than some of the private providers, which meant the staff stayed longer, which meant the experience she got as a carer was very different. So actually that whole point of how contracts are worked is I think really critical actually to attracting and keeping the best people, because again, those of you who have experienced care will know when it's good, it's absolutely brilliant and makes a world of difference to the person being cared for and actually their family around them. Whereas when you have a bad experience, that knock-on effect goes very widely. So it's a really key issue. I don't normally do this, but just while I'm giving a chance for the answer to come back from Ingrid a little bit more, I'm going to just ask our attendees just in here, what do they think is the one real thing that would make a difference in terms of social enterprises being able to fit within the National Care Strategy and provide good services moving forward? So I'm going to ask a question of our audience, which is, what's the big thing that you think would make a difference and that the reforms should be considering? That's put the attendees on the spot, hasn't it?
I'll be taking note, because that's a super useful resource. People, I think Ingrid's coming back and saying I'll relay more information when I have it.
Yeah, we'll send it out with a copy of your slides, Hannah, to everyone. And the attendees have gone silent on the big thing. So I'm thinking, I mean, we know there's lots in the consultation. I think we've said all along that, and I think Ingrid noted this through stakeholder groups, and this isn't a case that the consultation's closed and there's still no chance to input. There's still a lot going on in terms of sharing thoughts and opinions. So again, albeit we haven't had stuff come through in terms of the biggest challenges from our attendees, there is still a real chance to, I'm going to use the Social Enterprise Scotland phrase now, get your voice heard. So Duncan will like that. I've got getting your voice heard mentioned.
Voices at the centre, so you know.
Yeah, so please do. You know, we're here to represent on those stakeholder groups and want to hear from practitioners in this field. So really important. I'm going to just come in with a last question, if I may. This is a real toughie, actually. I'm not sure it's fair to ask. Oh.
Do you know what? I actually really welcome tough questions that I can't ask, because it gives me another perspective to go away and think about it. And just for the benefit of everybody, I said to Naomi at the beginning, I'm such a technophobe. I can't operate double screens, all the rest of it. So I'm very comfortable in not knowing stuff. So ask away.
Okay. Brace yourself. What do you think is the biggest challenge that is faced in establishing a national care service?
What do I think is the biggest challenge? I think the biggest challenge is getting it right. And we need to get it right for everyone. So I'm kind of nicking a phrase now, but I genuinely think we do. If in government we are taking on board the largest public sector reform since 1948 in the creation of the National Health Service, we have to get it right for people. And that, I think, is going to be the biggest challenge. The reason I think it's the biggest challenge is that people, regardless of their age and regardless of where they are, have differing needs at differing times for accessing social care support. People have different experiences of working in the social care sector. And if I take it down simply and just give you my own perspective rather than a government view, I want to be happy when I go to my work, and I want to feel valued when I go to my work. I want to make sure that my son can access the mental health services that he needs to support him when he needs them. And I want to make sure that if my mum goes into a care home, that she is well looked after, and, you know, that my brother in Aberdeen can have enough funding to get a personal assistant who can make appointments and isn't struggling to go. So it's all of these things that are milling round my head. For everybody, I have been in this post for 11 months, having never worked in health or social care in a 33-year career in government. And I have been outstanding and amazed by the dedication of people who have worked and got in touch and feel undervalued, and that breaks my heart. But B, saddened beyond belief of some of the personal reflections of individuals when they've been telling us their stories. So as a civil servant and kind of taking forward this work, I think this is the huge challenge to get it right, but it's one that I am utterly dedicated and invested to working on. And it is difficult, and we have to do it with people, not to people. That's, I think, my big reflection.
Thank you, Ingrid. And, you know, I actually think bringing that humanity both to this session and actually bringing the humanity to the reform as a whole is the thing that's going to be critical. We have to listen to some of those tough stories, and we almost need to bring our personal selves to some of this debate. I'm glad to see Hannah nodding again. I'm always pleased to see you nodding. Now you said you're a nodder, Hannah. What do you think is the biggest challenge? And then I'm just going to come in with the last question of the day, which is, what conversely will you think is the best opportunity for both the care service but also for social enterprises within that? And they'll be the closing questions.
I like that actually closing question, because my answer to the first part of that is probably more negative than I want it to be, in that I think the biggest challenge is taking what will hopefully be robust, person-centred, based on lived experience legislation and policy. You know, I think there's a lot of really good input gone into this, and making that happen in practice. We've got examples of that before. So self-directed support legislation, by and large, it's good legislation. It's good policy. In practice, it's hugely variable. And there's been, you know, overall has improved people's experiences of social care according to, you know, a range of input. But there is still the good, the bad, and the ugly, for want of a better phrase, and those extremes. And that's what 2013, 2014 that came in. That's a good few years down the line. We're still seeing major problems with implementation in some places with some groups of people, and that's a real challenge for any new system. Doesn't mean it can't be done, but it is a challenge, and to see that sort of properly brought down to every level of engagement. The other question was basically opportunities.
I like to finish on a positive. It's just my style.
Yep, I'm just checking. I'm paraphrasing that. What was much longer. I think the opportunity here is to do more than just consult, because consultation is one-off. And if this is meaningfully embedding co-design and co-production and proper development, I think David's just put in the chat something that I'm looking at and going, yes, that's an opportunity that we cannot afford to miss. And the reason we cannot afford to miss it is not only because the numbers of people affected in myriad ways, as discussed here, it's because this is a sector that is straining at the seams after the stresses of COVID. You know, if we don't get this right, we can't not get this right, basically. So we have to take the opportunity of so much information shared through the Promise, the Independent Review of Adult Social Care, the National Care Service consultation, the ongoing work, and build on that, and take that to develop into something that Scotland can actually point to and go, hey, look, human rights legislation that improves people's experiences of social care.
Thank you, Hannah. I mean, we're coming back to this people-centred approach time and time again, and I thought the comment about the policy into practice was also really critical, because, you know, it's the consultation's great, the big reforms brilliant, we welcome that, we're always keen to see what comes out of it, and I guess it's why we always come back to the same procurement questions. There's great frameworks and policies around procurement too, but in practice they don't always translate. So I think this is an ongoing thing. Ingrid, I want to end on a positive note for you. What do you think is the opportunity for social enterprises that comes out of this?
I think there are a number of them, Naomi. I think in terms of next steps, which is kind of picking up a little bit on your question and David's comment. So we have got ministers making a decision sometime soon. We have got a range of impact assessments which we will be engaging with people. So there'll be like mini consultations to really understand the impact of whatever decision ministers make. A number of groups that have either been established or will about to be established working on this, and a dedicated communications strategy setting out how we think the path will look. There's a huge programme within government wrapped around this. How do we communicate to everybody each phase of the programme as it's developed? How are people being involved? So once we have that, and we have a clear steer from ministers, it will be really, really easy to reach out to people and say, okay, we're now starting to think about the development of engage commissioning and procurement, okay, and we need a range of views pulling this together. And I think it's at that point, Naomi, because you've all made the connections and reached out to us and invited us to come and speak, and we can then start to reach out to all the different organisations as necessary to get them involved in considering the impact of the final decision, but then shaping what's going forward. So this is, you know, we started the conversation, Feely started the conversation by publishing his report. Ministers responded by committing to establishing a national care service and consulting on it. And the consultation for what, yeah, and Christie Principles, yes, I can see that, Hannah. For want of a better word, we're going to continue to consult and engage the whole way through the process. So there's going to be numerous opportunities for anybody who wants to be involved to be involved.
Thank you, Ingrid, and I think we'd welcome that from the social enterprise sector. And you know, if there's anything we can do, I guess in terms of bringing some, creating opportunities for good case studies to come forward and present, you know, we would happily help facilitate all of that, because there are some great examples out there, and they don't always get their voice heard or have the capacity to push for meetings, but we can invite them in if we know we've got those opportunities. So we'd love to do more of that as well if we can help. So thank you. That was a big session today. It's a big reform, much needed, I think, much needed. And yeah, come back to Hannah's point, we've got this one chance to really get it right. It's the biggest reform that's happened. Let's not lose the opportunity. And it sounds awful to say we're all going to get old one day. This is, and it's not just for the elderly, it's for people now, but we're going to need this. So we have a real duty to get it right for everyone in our community. So thank you very much, Ingrid, and thank you, Hannah. It was great to have you with us on today's session. I'll close the session down in a second, but I'll leave the chat open just so people can look for any of those links quickly. I'll keep it open for a few minutes, and I'll perhaps pick up with you, Ingrid, just on sharing a few links that might be helpful as well, based on some of the questions that we can send out with Hannah's slides.
Yeah, I think the other thing, if people are still on, Naomi, once ministers have announced the scope and the remit of a national care service, I or someone in my team would be really happy to come and attend another webinar. And I think by then people will know what ministers will know the scope, and it will be easier to have answers to some of the more detailed questions that people are desperate to understand. So very happy to have someone come back to a future seminar.
Fabulous. Thank you, Ingrid. And I know Duncan will be there with his notebook and pen, almost penciling in a rough date as we speak. So thank you very much. And thank you to both of you for joining us. And like I say, I'll shut the session down, but I'll just keep the chat for a few minutes. And have a great day, everyone. Here's hoping the storm stays low. Thank you. Bye-bye.